First thing we're looking at here, I've just started up the simulation a few minutes before Sarah ended her presentation. And so we'll see this getting started message every time a simulation begins. This is simply to remind learners of some of the key controls, like how to communicate with a patient, how to conduct a physical exam, and then what other resources are available to us during the simulation. If this is the first time that you've actually run a simulation, there's also the option to go through a tutorial that'll walk you through some of those key controls. But I'll just click go ahead, got it, and then we'll see Maya sitting in front of us. Obviously, she looks a little uncomfortable, so we'll want to start talking with her pretty quickly here. So the door notes, those will pop up at the beginning as well. That just kind of gives an overview of the scenario and also instructions to the learner. For now, though, I'm going to dismiss this so we can see Maya in her full screen view here. Probably first thing I should do is introduce myself and see what is going on with Maya from her own perspective. So I'll go ahead and do just that. Hi there, my name is Nurse Nick. What's your name?
Hi, Nurse Nick. My name is Maya.
All right, Maya, and what brings you into the hospital today?
I've got this insane headache that won't go away, and I'm really nervous. I'm having contractions. My doctor said I should get checked out for a headache, and I'm getting worried.
Well, I'm definitely glad you came into the hospital. Don't worry, we'll take good care of you. How far along are you in your pregnancy?
I'm 36 weeks pregnant.
And do you know the gender of the baby?
Yes, I'm having a girl.
Oh, congratulations. First kid?
Thank you. This will be my second baby.
Well, let's get back to the task at hand here. Tell me a little bit more about the headaches. When did they first start?
I started getting headaches this morning, but I've had lighter headaches on and off for the past few days that I didn't think much of at first.
And if you had to rate the pain on a scale of 1 to 10, what would you rate it?
Right now, it feels like a 7.
That's pretty bad. Any other associated symptoms that you've noticed that go along with the headaches?
I've also started cramping.
Have you noticed any changes in your vision?
This is weird. My vision has been blurry. I'm looking through a fog.
Have you thrown up or vomited at all?
No, I haven't.
Well, let's do this. I'm going to go ahead and get you hooked up to the vital sign monitor here, and we'll check your vitals and go from there. Does that sound okay?
Yes, that sounds okay.
So I'm just going to pause it here for a moment before we hook Maya up to the vital sign monitor. A few things I always like to point out with the communication. First off, nothing is scripted. So it's really going to be up to the learners to identify what the best questions to ask their patient are. And then based on the response that Maya or any other scenario gives, build your follow-up questions around that. And then obviously every learner, they're going to phrase their question in their own way. And that's where the power of the communication engine is able to come in, understand, and then respond back with that scenario specific response. So with that in mind, I'm going to change my view over here to the left, and we'll see we have a vital sign monitor. So I can grab these different attachments here and put them on Maya so we can get a full reading of her vital signs. So if I do that and then come over here to look more closely at the vital signs, certainly we can see blood pressure is pretty darn high, so something we're going to be concerned about. Respiratory rate's also pretty high, so something for us to keep in mind as well. Let's go ahead and let Maya know this and come up with a treatment plan for her. So I'll dismiss the vital signs here. All right, Maya. So it looks like your blood pressure is pretty high at the moment. I'm just curious, have you been monitoring your blood pressure at home?
No, I haven't been monitoring my blood pressure at home. My doctor told me to go to the if I felt headaches or vision changes. So I
Okay.
thought I should go to the just to make sure everything is okay.
No, certainly glad you came in, and don't worry, we're going to get you taken care of. And I guess before I move on to the physical exam, maybe if you could let me know, are there any other symptoms or concerns you're having aside from the headaches and the cramps?
I also feel a burning sensation around my vulvar area.
How long has that been going on for?
It started a few days ago.
Do you have any history of STIs?
No, I don't have any history of STIs.
That's good to know. All right, so let's do this. I'm going to go ahead and take a closer look. Is it okay if I take a listen to your heart and lung sounds?
Sure, I don't mind.
All right, so once we've gathered all that information, we can move into the physical exam. So that is an option that we have here. So to do the physical exam, all I need to do is click on this button down here in the bottom left, and that's going to change the positioning of the bed here. And I've got a few additional tools that I can use to take a closer look at our patient. So for example, if I wanted to listen to her heart sounds, her lung sounds, her bowel sounds, I can grab the stethoscope here, place it down on the patient's listen to the lung sound, and make sure that they all sound normal. Obviously, her heart rate's pretty fast, so we'll hear that reflected in the auscultation. In addition to auscultation, though, I also have the ability to look more closely at eyes, ears, nose, mouth, skin. With a glove tool, I can also palpate different regions of the body. So if I want to palpate the abdomen, I can do that with a glove or the hand tool here and get an indication if there's anything abnormal popping up there. In addition to that, with the physical inspections, if there's areas on the body that I can't click on per se, I do have the option to get some additional results here. So, for example, she had mentioned that there was some burning sensation in her groin area. I could choose to do an external pelvic exam and then immediately get the results of that. So it looks like for Maya, even though she indicated verbally that she didn't have a history of STIs, maybe it was something that she didn't necessarily want to talk about. If I perform that external pelvic exam, I'm actually seeing that there are some lesions here in her genitals that certainly something to be aware of. And I'll probably want to take a closer look at her diagnostic results to see if there's anything indicated there. So that's the physical inspections. What I'm going to do now is exit that and get her back sitting up. And then once I do that, I'm going to move over to this diagnose and treat window. And this is really where a lot of that NCLEX reasoning comes into play. So if I click on first that diagnostic result, so these are already orders and labs that have been requested and ordered. So I have the ability to basically, I'm just going to pop this over to the middle here so it's a bigger view, take a look at if there's anything abnormal that I should be aware of. Specifically, let's take a look. If we take a look at this infectious disease results here, I can take a look that she did in fact test positive for HSV1 and 2. So it's possible there that she's having an active outbreak. And certainly that's something that we want to take into consideration, being that she's about to go into labor. And again, I can go through and take a look at all of these results. No reason necessarily not to. They're all available to me. They've already been ordered. It's not like I'm ordering them again per se. And then once I have the clearer picture, having looked at all of these diagnostic results, I can go into this diagnosis window and put what I believe to be my diagnosis of what's going on with the patient. Obviously, with the pretty high blood pressure, the complaints of headaches, she's most likely experiencing some kind of preeclampsia. And then with that burning and the visualization of the lesions on the genitals, she most likely also has that active genital HSV infection. Sarah,
Can I jump in? I was about as the clinician. So one thing that we did put in here, we made it a little tricky having the preeclampsia as well as severe preeclampsia. So if we really want Nick to get the point, we do need to select severe preeclampsia as indicated with her visual changes. So that's that key that differentiates those things. So that's going to allow us to be successful here. So that's
okay,
all.
yeah, good, because I would have missed the points there. So good to know. Phone a friend came in handy there. So I'll leave the diagnosis as these two for now. And then once the simulation is over, we'll see if I got full credit in the diagnosis section. Next up are the nursing interventions. So, what possible actions I can take to help with the patient. One of the things that we're going to certainly want to get under control is that high blood pressure. So I do have the option to initiate that magnesium sulfate for the severe preeclampsia. So when I click on that, I will get intervention indicated, and then also to refer to that debriefing page at the end of the simulation to learn more about why this specific intervention was indicated. Now, let's say I chose an option that was not indicated. So, for example, administering antibiotics for a UTI. If I were to click on that, I will get instead a red indicator saying, hey, this intervention is not indicated. And again, please refer to the debriefing page at the end of the simulation. Let's see, probably some few other things that we'll want to do is obviously with the HSV outbreak, rather than having a vaginal delivery, we're going to want to prepare the patient for that cesarean delivery. So I'll go ahead and click on that as well. And then I get that green highlight, intervention indicated. So all is well there. I'm not going to go through and choose every single intervention here, but that kind of gives you an idea of what the intervention section looks like. And then last up are the complications. So choosing the potential complications that could be going on with the patient. And that's going to be very similar to the intervention side. In this case, let's say eclampsia, and then I can click on this little eye here to see if that is a complication that's indicated or not. So for example, if I were to say deep vein thrombosis, in this case, that complication is not indicated. And again, I could go through here and try and get all of the ones that are indicated as opposed to not indicated. Sarah, did you want to add anything to that portion?
I think you basically covered it. Thanks.
Yeah, perfect. So then at the end of the simulation, once I've worked through all of this, then I could say some parting words to Maya, but in this case, I'm just going to click on this little arrow button up here at the top right. That is going to end the simulation. I'll just get a confirmation message making sure that I want to end the simulation so nothing's done unintendedly. And then, as Sarah had mentioned, we have this multiple choice NCLEX style quiz that shows up here at the end of the simulation. So first starting off, the provider order, and I'm going to probably butcher this name here, labetalol 20 milligram IV push for severe hypertension. We have an available labetalol for 5 milligrams. How many milliliters will the nurse administer? I've done a little bit of cheating here, so I already know the answer, and I'm going to put in 4 milliliters for that. Let's see, the patient has active genital HSV lesions and is in labor. What is the appropriate nursing action? So prepare for vaginal delivery, initiate contact precautions, discontinue fetal monitoring, or apply internal fetal scalp electrode. In this case, because of the active outbreak, we're going to go with initiate contact precautions. And again, there's many different questions on here. I'm just going to choose a few random ones for these last answers or questions here, just so we don't have to go through every one, but I'll get my results here at the end. So now the simulation is over. I see this debriefing content in front of me. So as those different interventions and complications indicated, I can read through here and see what the rationale is for the correct actions and the incorrect actions, and read through, get a better understanding of all of those. And then as I scroll down further, I'll also see the quiz rationale, which is great. But then lastly, I'll have my own personalized assessment to see how I did. So 38%, obviously I'm not ready to take the NCLEX, but I can look through all of these different actions, see what I did correctly, and then also see what I missed and what I should think about for next time. I could run through the case again, try to get 100%, and improve basically my overall understanding and readiness for the NCLEX. So that is Maya Reyes. I hope I did the scenario justice.